Vaccine eligibility is expanding in New York. Governor Cuomo says those with underlying conditions will qualify for the vaccine on February 15th. People with comorbidities or those who have two diseases or illnesses at the same time. Now, this news comes as the city opened its first mega site at Yankee Stadium. This is for Bronx residents only. And of the 15,000 appointments for the first week, we understand that 13,000 are filled already. The Bronx continues to have the highest COVID-19 positivity rate at just under 7%. That's almost double that of Manhattan. News 4's Andrew Siff live for us at Yankee Stadium, where, Andrew, I understand people have been telling you it's welcome news for the community there.
Absolutely, Natalie. They're still doing vaccinations as we speak. Behind me inside Gate 4 at Yankee Stadium. The hours right now, 8 a.m. to 8 p.m., but the goal, as soon as they have enough supply, is to go 24/7. The anticipation was palpable.
Opening day at Yankee Stadium.
Opening day for vaccinations. A chance for Bronx residents like John Bradley.
I'm 71 years old, diabetic. I can't take a chance. I'd rather take the vaccine.
The city's pitch to expand the vaccine effort aimed to get an underserved population protection against COVID. The mayor out on River Avenue handing out flyers, urging Bronx residents to visit somosvaccinations.com or call 1-833-SOMOS-New York.
For people who can't get online or telephone, we have opened up 4 ticket windows here, which are going to be manned by very experienced people from the Yankees and Somos. You can come here, register, get an appointment.
By afternoon, 13,000 of the week's 15,000 vaccine slots had been taken, and it's about to get a lot busier. Governor Cuomo today announcing New Yorkers with comorbidities, including cancer, heart conditions, obesity, pregnancy, pulmonary disease, including moderate to severe asthma, eligible for the vaccine statewide beginning February 15th.
Whoever you are, 94% of the deaths are people with comorbidities.
But before that begins, the spotlight on the Bronx. Spike Lee here early, working on a documentary. Bronx residents lined up along 161st Street, even in the rain. And the Yankees brought in the ultimate closer to make the case.
It's okay to be vaccinated. I'm online, okay? When my turn comes, I'm online to get it.
The event today even got a lifelong Red Sox fan to do the unthinkable.
For one day only, I will declare myself a Yankee fan.
An act that got the mayor mocked by Yankees manager Aaron Boone.
The hat looks excellent on you. You're very tall. I think you got a little taller. Yeah.
In baseball parlance, that remark from Aaron Boone is known as a walk-off. He hit a pretty famous walk-off in this building. And meanwhile, Citi Field is going to be a mega vaccine hub as well. In a matter of days, according to the mayor, could open as soon as early next week. We're live at Yankee Stadium. Andrew Siff, News 4 New York.
Andrew, thanks for the latest. Now to Connecticut, where the Department of Health will be hosting a COVID vaccination clinic at Dunkin' Donuts Park tomorrow. The vaccinations will be available for Hartford residents who are 75 years old and older. An appointment is required, though. Those who have appointments are asked to arrive at their scheduled time and not before. That is all in order to keep the crowd size down. Here in New York City, Governor Cuomo hinted that he might push up the date for indoor dining to resume. Now, it's set to open Valentine's Day at 25% capacity. But if these COVID numbers keep dropping like we're seeing, he might start to allow this on February 12th, which is next Friday. In New Jersey, relaxed restaurant restrictions have begun. The curfew is off the table if your town chooses to do so. Indoor capacity sits at 35%. Outdoor dining is expanding as well. News 4's Brian Thompson live for us in Red Bank tonight, where it's welcome news on the weekend of the big game. Brian.
Yeah, no question that big game could make a big difference for these restaurants. You know, it's a lifeline for them, not so much the 35% they tell me, but being able to stay open and past 10 o'clock if their town chooses. Here in Red Bank, they've said so long to the curfew.
For the first time in nearly a year, struggling restaurants like Robinson's Ale House in Red Bank will be open tonight past 10 p.m.
We haven't seen this particular type of suffering since the Depression.
The governor lifting the 10 p.m. curfew, letting cities and towns make their own decisions. The news welcomed by owner Tim McClune.
The public has shown tremendous demand for restaurants and tremendous support.
And welcomed by customers as well.
By the time people finish work or do things during the day, and then they go out and they have dinner and start, 10 o'clock rolls around very quickly.
But in signing the curfew option, the governor's concurrent move to allow 35% dining capacity instead of 25% didn't make as much of a splash.
We might be able to figure it out to put a table someplace, but that's it.
I think it's better than 25, but yeah, I think that it should be 100.
What we did find here was both staff and customers pretty much done with dining restrictions almost a year now after the pandemic took hold in New Jersey, despite a death toll over 20,000 and hundreds of thousands either sick or testing positive.
I think just eliminate the rule and see what happens.
And yet, at least with a Super Bowl looming Sunday, there was some hesitation to be out.
Too much hustle and bustle.
Safer at home?
You could say that.
The governor says the Super Bowl was not the reason why he did this. It was the declining rate of infection, but he did urge people and warn them and remind them that the limit inside a home, for example, is just 10 people. Even though restaurants can have more, or dining halls, or catering halls, whatever, churches, inside at the home, he says, please keep it under 10 people. We'll see how well that goes as the Super Bowl comes up and in the next couple of weeks to see if infections go back up. Live in Red Bank, Brian Thompson, News 4 New York.